Fertility myth number 6. I'm over 40, I must do IVF. It's very common. Patients turn up in our clinic and said that, well, I've tried for some time and I'm over 40, so I was persuaded, or I believe that I should do IVF. And 2 or 3 cycles later, they were not successful and they came to us. This is a common misconception that IVF should be done when someone is older. In fact, the opposite is true, because the best predictor for IVF success is still age. But age is not the best predictor for natural pregnancy. There's a major paper published in 2017 in the American Journal of Obstetrics and Gynecology that showed that for women between 40 and 45, if they don't have any anatomical problems, there's no fallopian tubes problems, there's no hormone problems, there's no cycle problems, no ovulation problems, no identified fertility issues, then the chances of them having a successful pregnancy after 6 months of trying is 27%. And after 12 months of trying, that's 1 whole year, is 55%. So women between 40 and 45 are perfectly able to get pregnant without any help if there's no identifiable fertility issues. The problem is that this misconception seems to be everywhere in the internet. Sometimes we have patients coming into our clinic, age 35, and they said that they were persuaded that they should do IVF. And other than this paper, let's think a little bit more about this. What determines whether we are going to be able to get pregnant is not our age, really. I mean, provocatively speaking. I mean, let's say that age is not really that important. What is most important is our reproductive age. Let me give you an example. If a woman reproductive age ends, that is when she has menopause at the age of 30, how likely is that she is able to get pregnant? Well, highly unlikely or impossible. She's in menopause, although she's only 30 years old. And if you are 42 years old, you have regular cycles, good ovulation, you still have a good chance of getting pregnant, as this paper I mentioned showed. So age is not really that important. You are 42, you're more likely, far more likely to get pregnant than someone who's 30, who's actually in early menopause. So that shows that age itself is not a problem. What we need to think about is reproductive age.